especially in home health, you can be on your own a lot. And I think Care Options for Kids does a great job at making it feel more like a team.
As a bilingual speech therapist, I serve Spanish, English speaking kids with issues with articulation, language problems, as well as feeding.
So for occupational therapy, we work a lot on things that we call ADLs, or activities of daily living. So that includes dressing, feeding, brushing teeth. I also work a lot with my kids on things like emotional and self-regulation, motor planning, executive functioning, fine motor skills, kind of a wide range.
I decided to do pediatric home health because I like the one-on-one contact with our patients versus a school therapy that you just get to see them in their natural environment and you're able to provide a lot of parent education and coaching. Emily and I co-treat quite a bit with a lot of our patients because our interventions and our goals overlap quite a bit. So it's easier for parents in terms of scheduling, and they're able to see, what can we do in speech that can carry over to OT and vice versa. And I think other agencies don't promote that as much as a Care Option for Kids does.
Just working more in a team is extremely helpful, being able to collaborate with one another.
For example, Alejandro, we've been working on articulation for a few years now. I would say he's probably 90% intelligible now, so that was one of the main goals, was trying to increase his intelligibility. We work a lot of reading because he loves reading, so I'll pretend that I don't know what he's saying if he mispronounces his word, and he does a good job of identifying when I make errors. So it's like we play, I'm the teacher, you're the teacher, and who can be clearer to understand.
Usually we'll start off our sessions more with like gross motor movements or heavy work input to help with that regulation piece. We work a lot on calming and coping strategies just to get them ready to kind of sit and work more on the speech side of things at the table. So it's kind of a good balance. We'll start off with that and then kind of end with that and do other activities in the middle. But a lot of like identification on emotions and expressing how they're feeling, things like that.
Care Options for Kids does a good job at listening to what your hours are and what your goals are as a clinician. So if you wanted more of a hybrid schedule versus an all in-person or all virtual schedule, they will try to find you a good fit for different patients that can accommodate what you're willing to do.
I think they offer a lot of opportunity for growth, a lot of opportunity to take continuing education courses. And again, just that like feeling of being on a team. I feel like a lot of other companies don't offer that, especially in home health. You can be on your own a lot, and I think Care Options for Kids does a great job at making it feel more like a team environment.
And they also do a good job of wanting that work-life balance, so making sure that all clinicians are completing their documentation in the session. That way it's not something that is done 7 p.m. when you get home from work.
Just being able to create your own schedule is extremely helpful. It's just very flexible, so if there are days where you have appointments or other things that you need to attend to, it's very easy to kind of work with your families to move that schedule around. Especially in healthcare, things are constantly changing and evolving. They offer a lot of opportunities to take classes, and I think it's just motivating, like when you work with new kids all the time, just to keep up on all the changes and make sure that you're providing the best care possible.
Getting that education is just going to help our sessions to better understand why they're having a hard time, or how can we help them to be the most successful that they can.
Most classes are a couple $100, so it's nice that they offer all of those for free.